What is ascariasis? It is the infection caused by Ascaris lumbricoides. Its symptoms depend on the location of the worms in the body. It is usually asymptomatic in case of light infections. In the early phase, the focus of infection is usually the lungs. In the late phase, the focus of infections is usually the GI tract. Early phase of ascariasis. The disease that occurs in early phase is Ascaris pneumonia. It occurs due to migration of the larva through the lungs. During its life cycle, larval antigens cause a tissue reaction in the lungs, leading to signs and symptoms of Loeffler syndrome. That is, cough, wheezing, and occasionally hemoptysis. Blood tests will show eosinophilia. Chronic phase of ascariasis. Gastrointestinal problems. Ascaris worms do not attach to the intestinal wall. They live in the lumen of intestine, and live on food ingested by patients. They eventually grow in size and cause obstruction of gastrointestinal lumen, mostly at ileocecal orifice. They rarely cause obstruction of pancreatic duct.